This is a talk that I did at Osher Senior Learning Institute at USF in September of 2020. The title of the talk is a bit enigmatic. Some of you may not know who Lister was, but at least you may know Listerine. And CRISPR is now, this it can be briefly summarized as history of medicine. I use this in a talk on antibiotic resistance, but it is worth noticing, and it's pretty self-apparent that in the hunter-gatherers days, we were out all human beings, or Homo sapiens, as they were after we put the Neanderthals out of business, as to relying on roots. And now, afterwards, when organized religions took over, prayers were the big in thing, followed by sort of anything that goes, so-called snake oil type medicine, followed by the advent of antibiotic, which took hundreds of years from the origin of humankind. And it was a surreptitious discovery, and which all of you studied in high school about Alexander Fleming and as to how he discovered penicillin. And then afterwards, we were too cocksure that we had cured all the infectious diseases. Little that to say that the bacteria were far more smart than we were, and promptly developed resistance, requiring more and more powerful antibiotics until the present time, when the basket is almost empty and we may have to resort back to not quite to the primitive plant roots, but at least to something that is a variation on viruses called phage therapy, but more on that later. Probably new to quite a few of you, unless you are involved in genetics and keeping up with the science news. By the way, this is one of the old advertisements for Listerine, which was marketed for all sorts of things in the past, and it was commercialized to the nth extent. And CRISPR has nothing to do with Kentucky Fried Chicken, but stands for an abbreviation, which is a mouthful to say the least. It's called clustered, regularly interspersed, short palindromic repeats. Now again, you'll have to wait until the several sessions down the line to know more about CRISPR. Now again, this is, some of you may remember the old commercial from Virginia Slims that you've come a long way. So the same way, to extend the analogy further, we have come a long way in the art of medicine, which during the French Revolution, it consisted of primarily amusing the patient while nature cures the disease. So, but even now, even though we have quite a few tricks in our armamentarium, we have realized that we still have limitations, because it's not just the doctor and the disease, but it's a three-ring circus. One can prescribe medicine and advice, but if the patient is non-compliant, and even then, there are chances that in spite of all the measures in intelligence that you may apply, there is certain things called chance, and that we are all known as to how the outcome is not guaranteed. This is not like mathematics or physics science, and that is why medicine is still considered an art rather than a science. And now, again, this is very apparent to all of us that the human lifespan has increased dramatically from in last 50 years. Even in developing countries like India, where I was born in 1950, the average lifespan at that time was only 32 years. And it did not budge hardly any during the almost 200 years of British occupation. And that doesn't say much for the colonial rule. Because some of you may recall from my earlier talks on the history of British India that they used to spend more on military barracks than on healthcare, and even less on education. But that's a different story another day. But things have improved in the last 70 years. For example, Indian life expectancy has increased from 33 years to as much as 72 years, and other countries have progressed proportionately. For example, China came up from in the 30s, similar to India, to almost 78 years. And in the United States, at least, the women are living up to well beyond 80, and it is not unusual to see people in their 90s and even 100s. So this is a big pat on the back that we can do, but things are not as hunky-dory as we would like to think, because along with increased lifespan, we are running into newer and newer diseases. We had no clue that we will encounter them, such as Alzheimer's disease and dementias of all sorts. And the cost of looking after the elderly is going to be staggering, to say the least. Okay, moving right along, and the reason for that is not just medicine, but the big advance in public health. For example, the infant mortality has decreased dramatically almost all over the world. And to take the example of the United States, it has decreased from as high as 100. It was about 100 years ago to down to in single-digit numbers. Similarly, maternal mortality has almost flattened out the curve to near 0 percentage. And it still occurs, and there are pockets where mortality and infant mortality are high, primarily in the African American population, Latin population, and in less served area by healthcare. But that's another issue altogether. Now, and primarily the big advantage for this was it's not all just medicine, but the rise in public health, which took place in mid of 19th century in Britain, followed by that in the United States, and progressively increased, and that had a huge impact on improving the mortality and morbidity of human beings in the Western world compared to what the medical community had to offer, because it took a while to cure at least some type of cure for infectious disease. As you well know, that penicillin wasn't widely used until 1950s, and by that time the mortality even with infectious disease had already decreased. And so we can't take all the credit in the medical and pharmaceutical establishments for improving on human condition, but public health measures had a whole lot to do with it. Okay, moving right along, if, for example, if we had to nominate what were in the last 70 years, which were the greatest discovery that benefited mankind, these are the top, not just top 10, but top 15. The result can be debatable, but it ranges anywhere from various medications such as insulin, cortisone, penicillin, tuberculosis cure, preventive medicine. And then some of the surgical colleagues were not far behind with advent of heart surgery, joint replacement, kidney transplant, and so on and so forth. And last but not the least, in last 20 or 30 years, the genomic revolution has again made a dramatic impact in improving human condition, and especially for rare diseases. And more on that in the last sessions when we talk about it. Now, again, in spite of that, there has been a dramatic change in the healthcare delivery system, that in future, the healthcare delivery provider, as they're called instead of physicians or doctors, and to the chagrin of physicians, as we've all turned into healthcare providers rather than doctors, who are respected, venerated, and feared to some extent, that the field is being encroached upon by nurse practitioners, physicians, extenders, pharmacists, and so on and so forth. And again, the population distribution of medical graduates has changed dramatically all over the world, that instead of just the average white male who was the archetype physician from Dr. Marcus Welby's days, it's much more likely to be an Asian or African American or Hispanic, and more than likely there's a more than 50% chance that it would be a woman. And so the stereotype that women always went for nursing or to marry doctors is no longer true. They are in charge, and there is a dramatic shift that has taken place in medical school enrollment, and over the last 30 or 40 years. And now, in spite of that, there is a huge problem or dichotomy that we are witnessing and that can be called as a perplexing paradox. Then if you ask a lot of doctors, there is 70% of them would say are disillusioned, and they would not encourage their own children to seek medicine as a profession, however noble their intentions might have been when they signed up for it. And at the same time, on the patient aspect, in spite of improving quality of life and less morbidity and mortality, the patients are worried sick. They're worried about all sorts of real and imaginary illnesses like achy joints and problem with erection, or problem with social anxiety, or problem with GERD, which was simply heartburn until the pharmaceutical industry renamed it and introduced as a new disease. And this dissatisfaction amongst the patients and population at large had increased the soaring popularity of alternative medicine, including disciplines which I know little about, called Reiki or Reiki, homeopathy, and Ayurvedic medicine, and all sorts of other. Not to forget to mention meditation and taking tons of vitamin to increase your lifespan, and all sorts of things are being tried. But that's not our subject. At the same time, the other major issue is that with increasing lifespan, it doesn't come cheap. And United States, for example, the cost of healthcare increased from 5 to 6% in early 1950s to as high as 16 to 17% of the total GDP. And I used to tell my patients that we are sort of victims of our own success, that when our surgeons were able to successfully operate for heart valve replacement, and even in 90-year-olds, and if you could get them over the initial hump, then they were likely to do quite well. So we were victims of our own success. And at the same time, we've all seen advertisements on television for all sorts of expensive medicines. And that, to rephrase Eisenhower's phrase in our context, is the rise of the medical industrial complex, that we are seeing we are bombarded by advertisement for insurance policies and medicines that we need, or we can, and perhaps we cannot afford at the rate at which the price rise is going. Okay. Now, again, this is an interesting data which has nothing to do with medicine, but amongst all the species of mammals, especially, there is a linear correlation between life expectancy and heart rate. That I used to say that we are only given like so many billion heartbeats. Now, as you can see from the graph, that the smaller the animal, the faster the heart rate, such as like hamsters and mice have a heart rate in the approaching thousands, and obviously the lifespan is subsequently much shorter, because the faster you run, the quickly you run out of the real estate that Mother Nature had endowed you to. But at the same time, as you can see, that the human beings are outlier, and that may be partly that we have done that through our genius in our capacity for our brain that we have elected to, and that perhaps is explained by the fact that with menopause, the women's body starts deteriorating and men's fertility starts going down, and the programmed cell death, so-called apoptosis, takes over gradually, that you're not quite the same person at age 45 as you were when you were 35. And that's the sort of ecological imbalance, that we have upset the apple cart by using up more and more resources to keep ourselves longer. And it has come with a trade-off, that we may have conquered the low-lying fruit, but the more degenerative diseases such as arthritis, diabetes, hypertension, strokes, and dementia are raising their head and becoming a major issue. Vesalius studied in Paris, and his artwork was done by a pupil of Titian, and he not only just showed the anatomy and also showed the internal organs, and he also was an excellent teacher, and several of his pupils went on to contribute huge to the new anatomy. And some of the names that at least those in the medical establishment may recognize is one of his famous pupils was a guy named Falloppio, and for whom fallopian tube is named after. and which connects the uterus and the ovaries. And the other famous student of his was, they were all Italians in those days for some reason, was a guy named Eustachio. And he's well known to describe what is known as Eustachian tube, which connects your external ear to middle ear. And and at the same time, there were other people who contributed widely. And now Vesalius was immensely successful. He was a physician to Charles V, the king of France, and subsequently to his son. And he was able to acquire bodies, and one of his skeletons that he dissected is still on display in Basel, Switzerland, where he ended up eventually. And at the same time, so one of the first anatomy that might have been done, this may surprise you, was on, and at least the one that is well documented, that we learn things from Jeopardy clue, that was on Julius Caesar, who was assassinated by the Roman senators, as we all know. And now here is
was a boy from Flanders, and his name was Andreas Vesalius, and the name means weasel. And he was very proud of that name and had his own coat of arms made of 3 weasels. He was born in Brussels, educated in medicine in Paris, and then went to Padua, and there he started public dissections for students. And students realised he was the most skilled anatomist they had ever seen, probably the most skilled since Galen. In 1543, when he was aged only 28, Vesalius, we have a self-portrait here showing him in his best clothes, making a dissection of the muscles which move the fingers. He publishes this great book. It has in it over 300 wood blocks, all of which are done to the highest of standards. And historians have liked to think they were done by Titian or one of his pupils. And they like to think this is where science and art come together. But whoever did these images, they were very, very skilled. And Vesalius is very demanding of his artists, if they're not himself, and of his woodblock cutters. And if we look now at the muscle men, page 170 or so, this is what the Fabrica is these days best known for. A series of images where the musculature of the humans, of the men and women, are progressively taken off to reveal the muscles underneath and ultimately to reveal how they are attached to the skeleton. Look at the detail of the cutting of the woodblock. Unlike engraving, it is the white parts which are taken away. And the detail of this is quite extraordinary. But here, I want to look at the title page of the Fabrica. 7 books on the fabric of the human body, published in 1543. Now this image, Vesalius was totally in charge of, and indeed he is the star of this image. And if we look at this closely, we'll see a great deal about what he's doing with respect to emulating, recovering, the anatomizing of the ancients. To start with, here we see proudly displayed his 3 weasels' coat of arms. The whole presentation is as in a theatre, and indeed Vesalius of all people makes theatre the right place for anatomizing. It is a performance, it is a drama. We see Vesalius himself at the centre, looking out at the viewer. This is a convention of the time. It means here is a man with a message for the viewer. And that message is conveyed in his hands. His right hand is pointing to, touching the human body being dissected, and his left hand is pointed upwards to heaven. And the message is knowledge of this, the human body, in its detail and its workings, reveals to us knowledge of the Creator, God. So, anatomizing It's not a scientific subject, it is very highly religious. And if we look at some of the people in the midst of this chaos, at the front we see three larger-than-life characters dressed in togas, and they are the ancients. There's Galen, Aristotle, Hippocrates, and they're looking at Vesalius approvingly as he recreates their practice, ancient Greek anatomizing. Time was a boy from Flanders, and his name was Andreas Vesalius, and the name means weasel. And
Now, the next we come to one of the greatest name, at least in cardiovascular diseases, and his name was William Harvey, and he was an Englishman who, in the fashion of the days, went to University of Padua and studied under the well-known anatomist of the Italian School of Medicine, and which was one of the first universities that was established, and obviously none other than Galileo Galilei worked there. And now there, based on the anatomical lessons that he learned, he did experiments and challenged the Galenic thinking dramatically, because Galen had considered liver as a source of circulation and heart was just a conduit. But Harvey did calculations as to the amount of blood that is circulating, and based on simple mathematics, he challenged the whole concept and was able, with experiments. Now, but by this time, he was helped by one of the other anatomists who had discovered that the veins of a human body have valves and they regulate the flow of blood in only in one direction. And this gave him a big leg up, that he was able to establish that there is no way that liver can generate enough blood and to maintain circulation for the entire day. Based on and based on that, he was able to come to the conclusion that heart was the source of pumping that went on, and he established the circulation. Now again, this was before the advent of microscope, and he was not aware of the capillaries, and he was not able to explain as to how the blood went from left side to the right side and from right side to the left side. But at the same time, he again challenged the concept that there were holes in the septum, and he left that as for future generations as to explain. But at least he had proven the separate so-called pulmonary, that is the lung circulation, and cardiac, or as it is called, systemic circulation. And then he wrote his magnus opus, which was entitled in Latin, like it was in those days, the Motu Cordis. And this was a relatively small book compared to the anatomical discourse that Vesalius published, and was only like 70 or 100 pages, but it was a masterpiece of that time and established circulation. And then he was again benefited substantially from that. He went on to become a primary physician to James I and Charles I, and again was very successful British English physician of the time. Now he not only was limited to cardiac, but he also gave some thoughts to origin of life, and he's quoted to have said the famous saying that ex ovo omnia life, mean life originates from an egg. That wasn't that women were just a passive receptacle, and that males were the provider of life as it was thought earlier in the Aristotelian philosophy. And so he challenged again the concept of fertilization dramatically, and he also made some efforts to for offering treatment for scurvy. That was the serious problems for the British Navy, that as many as 30 to 40% of sailors died from scurvy due to lack of adequate nutrition, and especially fresh fruit and vitamins. Now again, at that time, the Enlightenment had helped England tremendously by the foundation of a very intellectual body called the Royal Society. Now, the Royal Society itself has one of the earliest and still running scientific establishment, and that is in vogue. And they had contribution from all sorts of things in astronomy, physics, chemistry, science, and all sorts of papers were published and accepted. And that was a fairly cosmopolitan society, that they accepted papers. For example, here's an example of a simple lens grinder from Holland, who through his own genius was one of the first ones who came up with the idea of microscope. Again, now that was a big controversy with the secretary of the Royal Society, of the illustrious handsome gentleman that you see on the right. His name was Robert Hooke, And he was a cantankerous, argumentative man, and he claimed that he was the first one to have discovered a microscope, and the controversy continued for a long time. But at least it is well proven that even irrespective of who was the first one who came up with the idea of microscope, Leeuwenhoek gets the credit for showing the bugs, because his instrument was rather simple, a simple metal plate, and with this specimen that was mounted on a pin, and he was able to see the secretions from his own teeth and even his own spermatozoa, and was the first ones to establish living organisms at a microscopic level, and was able to see life as it was never seen before by anyone that preceded him, and was a groundbreaking advance in the history of human knowledge. And now, again, on the English side, with the Enlightenment and following the Renaissance and Enlightenment, there were advances, and a gentleman named Thomas Sydenham, who is been credited to be English Hippocrates, and he was one of the well-established physicians who is credited with putting some human touch to medicine, as one of his dictum is again, sorry for the Latin, it's called a primum non nocere, and that's an old axiom which translates that do no harm. And again, he wrote varieties of expert books on epidemics, and he's the first one to have introduced opium as a pain reliever, and that again, was one of the few well-established medicine that was for the biggest purpose was for pain relief, that was used by Sydenham. And again, for those of you with some background in neurology may realize that Sydenham's name is well memorized in something called Sydenham's chorea, which is an abnormal motion of that human beings suffer when they have problem with their cerebellum, is the backside of the brain. Now, again, the opium has a very colorful history that after a couple of hundred years, East India Company, which had established a foothold on the east and west coast of India, did not have anything to offer Chinese in trade, because China was a pretty self-contained society, and they succeeded in forcing opium to the Chinese, leading to several opium wars. But that's another piece of history, and which we shan't dwell into at this time. Now, followed by that, there was another well-known Italians who made several contributions to the study of anatomy, and the well-known guy was with a nice charming name of Giovanni Morgagni, and he lived in 1600 to 1700, and he wrote a big opus on, which is again, to read the Latin, was titled De Sedibus et Causis Morborum per Anatomy, indicates, and that simply means in translation, on the seats and causes of diseases investigated through anatomy. That just again, we are getting to the scientific basis of medicine as we know at the present time, that the disease was not just a curse or astronomical basis, but there was a true organic pathology in the disease that took place that caused the symptoms. And he worked on that for a long time. And then again, he established various cause and effect relationship, and put anatomy and science of medicine on a solid basis of getting patients' history, making careful observations, and trying to interpret the gross pathology that he saw during autopsy, and coming to a logical conclusion of diagnosis. And this was again confirmed by various other Dutch scientists and physicians who were pioneers in the Enlightenment. And on the French side, there was another well-known pathologist whose name is less well-known, and his name is Francois Bichet. And he described various different types of tissues, again with naked eye observation of, for example, showing how the bone was different from muscles and the cardiac tissue was different from liver, and so on and so forth. So a variety of advances had taken place, and it took several number of people to make contributions to get medicine on a scientific basis. Now, the biggest advance that took place was surreptitious, and it traveled from the early 1000 to 1200 in China to with the Mongolian hordes to Ottoman Empire, and was practiced, and that's the practice which we have come to know as vaccination. The name itself has an interesting story, and it should be correctly called immunizations, but obviously the concept of immunity wasn't around. So that's why Jenner, who worked with cowpox, and a cow in Latin is called vacca, and that's how the name vaccination has come around and has stuck for several hundred years. Now, again, the Jenner's observation was independent, and the part of the reason that the milkmaid who worked, had a clear, fresh skin, and that again, got him to think about that this was perhaps because they were inadvertently infected with cowpox, which was the mild version of the smallpox virus. Now, prior to that, a lady, the medical historians have come to the research that a woman named Mary Montagu, who was the wife of the English ambassador to the Ottoman court, she had observed this practice in the Ottoman kingdom, but this again much more risky because that the serum or the exudate was taken from actual smallpox patient and was infected and was introduced into the skin by scratching. And again, that you can understand that there was live virus and it had potential to get out of hand and cause mortality and morbidity. And so that was wisely, and Jenner was wiser, and he managed to use cowpox. And not only that, Jenner was successful in challenging the young boy who was vaccinated by reinfecting with smallpox. Obviously, I doubt that he managed to get informed consent, but at least then he was able to prove that yes, that the child was immune to smallpox. Now, Jenner is obviously the who is who, and his statue was placed in the Victorian era in the Trafalgar Square, and subsequently there was a lot of opposition. The anti-vaccine movement is not just present-day problem, but was very much alive in the Victorian era also. And at the same time, the anti-vaccine crowd and lo and behold, the military opposed that a simple country doctor statue was placed in the famous Trafalgar Square in the company of lords and ladies and the generals who fought some various battles for Britain. Now, so hence the statue, after the death of Prince Albert, who was a big supporter of Jenner, was moved quiet to Kensington Park, where it sits at present. And now again, that just shows that at that time the British Medical Journal, which was just a relatively new publication, had a rather pithy comment that the generals actually killed their fellow creatures while he succeeded in saving thousands. But that just goes to show you how much class society was Britain. Now, at the same time, there were other established people, and you can just say one anecdotal observation was from a surgeon named Percival Pott, and who showed for the first time that scrotal cancer, the cancer of scrotum or testicles, was more common in chimney sweepers, and that was due to the fact that these children were almost naked and they were exposed to this soot that came out from the chimneys, and with the constant exposure, that was the first incidence of industrial or occupational hazard. That was one of the big problems that was reported at that time. Now, John Hunter was one of the famous anatomists in Britain, and he again, did a lot of uh, well-known dissections, and so much so that he's remembered in the Hunterian Society of the Royal College of Surgeons. And now, and not only did substantial dissections, but he also did some original research in venereal diseases. Now, at that time, there were laws against autopsy and procuring bodies, so it has been rumored and perhaps true that he collaborated with literally grave robbers, and who provided the bodies to the surgeons. Now, he again, he also did treatment of various diseases of common at that time, such as urethral stricture, and he had taught various physicians who traveled from the colonies in the United States. And the well-known one was a guy named William Shepard. He was the who is who big surgeon in Philadelphia at that time. And there are some interesting stories of the colonial era goings on, and that his daughter was a rather beautiful woman and who collaborated with the British as well as with the locals, and she was the belle of Philadelphia, and eventually married a guy named Benedict Arnold, and then after the War of Independence moved to Britain and is presumed to have died there. And so this was again at the same time there were some other well-known people in Europe who were doing some work on challenging the orthodoxy of in chemistry that was in vogue from the Galen days, and we're trying to put some more scientific basis to human anatomy and function. Now, at that time, the electrical current was investigated based on animal electricity, aided by Galvani, who did some original experiments on frogs and subsequently on bigger and bigger animals, to the extent that eventually they shocked an elephant, and one of his relatives actually shocked the elephant to show the dangers of electricity and the power of electricity at that time. So there were some interesting times of it that and history of science of at that time, but we're digressing. Now, on the other front, well had taken place by a guy named Joseph Lind, and he was the ship surgeon at that time, and he was traveling on the for the British Navy, and it stopped the sailors who were suffering from scurvy, and for the first time experimented by dividing sailors into two groups, and half they were treated with fruits and a lime, and the other halves with other traditional remedies which were suggested. And then you saw that there was subsequent dramatic improvement in people who were treated with fresh fruit. Now, obviously, there was no concept of vitamins at that time. And then he subsequently, after returning to England or Britain, and he wrote a book which was the treatment of scurvy. But again, you would think that the Royal Navy, with all the mortality, would have accepted his ideas very promptly, but no such luck. It was ignored for almost 50 years, and until the time of James Cook, who went on around the world, and he was one of the first ones to use this treatment successfully, and to his credit, he did not lose any lives due to scurvy. So it just goes to show you that all the inventions take their own sweet time. Yes. Now, at the same time, there were other advances that were taking place on the other side of the channel, and at that time in Europe, the obstetrical care was delivered by midwives, not just female midwives, but also male midwives. And one of a pioneer from the French side was a woman who is not as well known. Her name was Angelique du Coudray, and she lived, in the 18th century, and she was one of the pioneer midwives. And she put science of midwifery or obstetrics on a more solid basis, and even went on to write a textbook about the art and skills that were required in delivering complex in providing complex obstetrical care. And here, to the extent that she devised some practical demonstrations and kind of a dummy to train others. And as you can see very well, that this was a rather fairly well sophisticated made dummy based on fabric, leather, and stuffing with actual human bones to form torso, and showed the stretching of the birth canal and the perineum and the process of childbirth. And you can see that this will be an excellent, hands-on teaching tool for young trainees. And on the British side, there was a well-known male midwife, and with a rather unusual name of William Smellie, okay, and who also did some excellent teaching for the science of midwifery, as it was called in those days. Now, moving on to the other side of the Atlantic, that one of the first abdominal surgery without any anesthesia was done by a rather brave or a frontier surgeon named Ephraim McDowell, and he had a woman who was in dire distress due to a huge abdominal tumor, and more than likely she was going to die. So she talked him into doing surgery, and in Danville, Kentucky, and that is where the first time intra-abdominal surgery was done. Prior to that, bladder stones were removed, but as those of you with a little background in anatomy might know, that does not involve opening the peritoneum or the sac that lines all the abdominal organs. And he was successful on his first attempt and removed a massive tumor weighing as much as 22 pounds without anesthesia, and the patient went on to live for 22 years. So that is the early history of abdominal surgery. And so you have to admire both the surgeon and the patient for their bravery, and congratulate them on their success. Now, moving back to England, there is a well-known museum in London. It's called the Hunterian Museum of Anatomy, that has all sorts of rather well dissected specimens, including the one of the well-known man named Charles Byrne. He was a so-called Irish giant, and more than likely, in retrospect, he had a tumor of his pituitary gland, which caused him to get to be giant size, and was a rather tall individual. Now, he had mortal fear that after his death he did not want to be autopsied, and he told his friend to bury him in the sea. But his friends were promised £100 and sold his body. So here he stands in the middle of Hunterian Museum to be gawked at for posterity for hundreds of years to come. And this was the early days of surgeons were trying to separate themselves from the barbers, who were the original surgeons. And there used to be almost a guild of barbers and surgeons. And finally, they distinguished themselves, and the Royal College of Surgeons was established and separated. And so again, and medicine was coming more into observation and thinking treatment. That, for example, the various senses had to be used, starting with feeling the pulse, sniffing for gangrene, listening for breath sounds, observe the skin and the eye color, and even, not to gross you out, but even to taste the urine, and various smells that were taught. And this practice continued all throughout and even in my own experience, we were taught to observe without touching the patient, and then palpate, and for unusual lumps and bumps, and then listen. And there was also a rather lost art that is no longer being taught, is called percussion, which the idea came from looking for how full the beer barrels were. It's the art of tapping to see whether there was fluid in the chest cavity or abdominal cavity for that matter. And the credit for that goes to a guy named Auenbrugger. And now at the same time, the Royal Society, they were not about doing any sorts of experiments. And a guy named Hale had measured blood pressure in a horse by connecting with various glass tubes and seeing how high the blood pressure was. But it took a long time, another 100 years, before blood pressure was used in practical sense, and this sphygmomanometer, as we know now, came into vogue. So it took a long time for the idea to catch on.
The Hunterian Museum is founded on the collection of John Hunter, a surgeon and teacher of surgery and anatomy from the 18th century. And he was one of the first people to try and transform surgery from its early roots in the company of barber surgeons to make it more into the surgery recognised today, based on careful anatomical and pathological science. Up until the middle of the 18th century, surgery in London was taught primarily by apprenticeship. You'd serve a 7-year apprenticeship with a surgeon. You'd pick up the nuts and bolts of what a surgeon was doing, but there was no formal tuition. You might go along to see some anatomical lectures at Barber Surgeons' Hall, but as a young surgeon, all you could do would be to go along and watch. There was no chance to actually practice dissection, and no teaching of anatomy or pathology in the way we'd understand them today. So what, first of all, William Hunter did was to offer courses to young surgeons in which they would actually get to carry out a dissection. So a very hands-on way of training, and in fact still a way in which most medical students learn anatomy today, so very successful. John Hunter began his career as an assistant working for William, and later went on to train as a surgeon and to give his own course of lectures. And between them, the Hunters really remade the landscape of medical education in London in the 18th century. Getting hold of bodies was one of the biggest problems for teachers of anatomy in the 18th century, because there was no legal supply of bodies for the work they were doing. They weren't entitled to the bodies of criminals, and the Anatomy Act, which guaranteed a legal supply of bodies for anatomy schools, wasn't passed until 1832. So they were having to rely on private deals with hospitals, with workhouses, with prisons, but most of all with the resurrection men, the grave robbers, the body snatchers, who supplied all of the private anatomy schools in Georgian London with the corpses they need. And of course, this was rather difficult. It wasn't strictly illegal, but it was hardly the thing your neighbours would look kindly upon. So people like John Hunter would have to work very carefully to make sure that what they were doing was seen as valuable by their peers and by their neighbours. Because bodies were so hard to come by, of course, most teachers also used preserved specimens or preparations in their lectures. So bits of body pickled in alcohol or dried and varnished as dry preparations, and they would pass these around in their lectures for their students to look at. So every teacher of anatomy, there were maybe 30 or 40 of them working in London at the time, would have a small museum. And people like William and John Hunter took that one step further. They collected on a much larger scale, building up huge collections that were used for teaching, for preserving the results of their experimental researches, but also as a way of displaying their work as anatomists to a much wider public audience. What's lovely about the Hunterian collection is it demonstrates John Hunter's wide-ranging interests. So we have bits that have come from his patients, tumours removed from patients at St George's Hospital, gigantic tumours that Hunter removed in operations without the benefit of anaesthesia for his patients. And you can really see where his skill as an anatomist helped him perform surgery in a way that was much safer and much quicker than his predecessors were able to do. In some cases, you can see how Hunter used his expertise and his experimental research to avoid carrying out major operations. So the coachman's leg, in which Hunter has carried out a much smaller ligation of an artery to avoid having to amputate a man's leg for a popliteal aneurysm, an aneurysm of the artery behind the knee. And then, of course, there are lots of specimens which come from his rich private patients, a bit of his local vicar, a bit of the Bishop of Durham, even a bit of the Archbishop of Canterbury preserved in the museum. So one gets the sense there was no great resistance to dissection amongst Hunter's peers in the 18th century. And then, of course, there are lots and lots of specimens of different animals. It's estimated that Hunter dissected over 300 different species of animal, thousands of specimens. And he was getting things sent to him from all over the world, giraffes from Africa, dissections of elephants from the Queen's Menagerie, and even whales sent back to him by horse and cart by his friend Edward Jenner, who was living down in Gloucestershire. You can just imagine the dismay of Hunter's neighbours when this rotting whale carcass turned up in his back garden.
Now, the biggest advance that took place in medicine, as I alluded to at the beginning of the talk, was in public health. And for that, the credit, to the chagrin of many physicians, goes to two lawyers, a guy named Edwin Chadwick on the British side and a gentleman named Lemuel Shattuck in Boston. And they were dismayed with the epidemic of cholera and the poor the short lifespan of various workers in Britain and in America at the same time. And they correctly attributed this based on careful observation to a lack of adequate sanitary conditions and primarily dirty water. That was the Thames at that time was a big stinking sewer, and they showed that by improving the quality of drinking water and washing had will go a long way in reducing the industrial mortality that was taking place. But by that time, with the early rise of industrialization, the population of the cities were exploding, and in Bristol and London and Manchester, the average lifespan of a poor person was as low as 16 years at that time. And they wrote position papers and succeeded in spite of enough opposition from Parliament in getting the poor laws passed, and that it improved the working condition to some extent and went a long way in prolonging the lifespan of Victorian England. And at the same time, the same observations were carried out by a surgeon named Lemuel Shattuck in Boston, and he wrote papers and essays on a sanitary survey of Massachusetts colony at that time, and succeeded in getting public health laws passed on the East Coast. And again, they tried to improve the water supply, but they were again in competition with railroads, which were more successful and managed to acquire more money. But at the end, they did succeed in improving the water supply of the two major metropolitan areas. And so these were the pioneers as to how this, and that's one of the reasons. And this next picture shows how the night soil was carried out to the Thames at that time, and death was always, around the corner. And you can see the cartoon showing the statue of cholera, which was the ever-present threat on both sides of the Atlantic. But the biggest name who is considered the founder of epidemiology was that any medical student would have learned in his public health lectures is a guy named John Snow, that by this time, due to communications and the East India Company, which traded all over the what was considered the Far East and at that time, and cholera was endemic in the Bengal area. And now the Mughals, who controlled the Bengal province at that time, they had wisely left the jungles in the delta of the big rivers alone, and they did not try to farm them. But the East India Company, in order to increase their, once they succeeded in getting a toehold in Bengal, cleared out all the vegetations and insisted that the local farmers use that for rice farming. Needless to say that the cholera germ was waiting in the waters that of the Bay of Bengal, and not surprisingly, along with the agriculture products that were shipped, the rats and the cholera germ managed to travel all around the world, and leading to the first cholera epidemic, which came as early as 1817, then subsequently in 1830s, in 1848, and 1852. And during the major epidemic of 1850s, John Snow, who was a physician and a surgeon, and he was able to statistically analyze the number of deaths that took place in the London metropolitan area, and he was able to trace that the mortality was much higher in the people who drew water from this pump near Broad Street in London. And he, again, in spite of his showing the data to the authorities, nobody paid attention to him. So finally, out of desperation, he goes and removes the handle of the pump, and within a few weeks, the mortality in that area decreased dramatically. So he was able to show. And again, one would think that the authorities would have made this as a permanent fixture, but nope. In about 6 to 8 months, the handle was again reintroduced, and this was done primarily by one company in order to save money. They had dug the wall not as deep as they ought to be, and they were fairly close to the septic drainage, so that was the source of pollution. And again, John Snow, not surprisingly, died at a young age of an infectious disease himself, and he was also one of the earliest ones to demonstrate the use of anesthesia in Britain.